Hi, nursing friends. This is Dr. Tracey Long. As a nursing professor, I share stories of inspiration at the end of my clinical shift with my nursing students. And that was like chicken soup to our hearts. Well, we're calling this series The Healer's Heart. And this is to help heal your heart as you heal the hearts of those you care for. So this story comes from a nurse called Susan Pearson. She worked in a long-term care facility, and we're calling this one A Rose So Sweet. And so there was an older woman named Rose in this long-term care facility who had progressive advanced Alzheimer's. And so her job was to make sure that, of course, Rose, along with all the other residents, were taken care of, that they were reoriented appropriately, and that they were safe. Well, Rose was one of their favorites, and Rose would always put an arm around any nurse she could get, and she'd say, "You are my angel." And of course, the nurses thrived on Rose and how she would lift their spirits. And any hectic days, Rose was always there that would make them laugh. One time, the nurse was at the nurse's station filing documents. Another patient had fallen, had to sign an incident report, and that's always a hectic time. And so Rose came and sat down at a chair that was next to the nursing station. And she could hear Rose kind of mumbling and groaning within her. And without looking up, she says, "What, Rose?" And Rose said, "Do you ever have one of those days when things just don't go right?" And the nurse is thinking, "Yeah, like right now. I don't have time for that, Rose. I got to fill out all of this paperwork." So finally, she looked up as she continued to hear Rose kind of, mumbling and struggling within herself. And she realized Rose was out there sitting in the chair, and she had taken her own pair of underwear and put them over her head. One of the holes went over her head, and her arm was out the other leg of those panties. Well, clearly Rose was in a little pickle. And so it did a lot to lighten the whole mood. And so, of course, they went over and helped Rose untangle herself and then shuffle her off to her next event or something she was going to do. Well, Rose was always in the right spot. Another event came when Rose was looking unusually sad, and the nurse was going about her way doing all of the medications with the medication cart. And so Rose came right up to the cart and just was about to, be in tears. And the nurse says, "Well, what happened?" And Rose says, "I don't have any money." And the nurse, thinking that maybe she was concerned about not being able to pay dinner, but that was like part of the all-inclusive nursing resident home, said, "No, your dinner's taken care of. You don't need to worry about that money." Well, Rose looked concerned and said, "I don't have any money to pay for Mass." So she thought she was at Mass. Well, the nurse thought, "I can solve this." So she had coin in her pocket, and she handed it to Rose. And she said, "See that box right there?" referring to the medication cart that had lots of drawers and boxes with all the different supplies and medications in it. She says, "Just open up that drawer and you can put your money in there." So Rose came over with her coin, opened up the drawer and put in the little money, and then beamed. She looked as if she'd won the lottery. She says, "You are my angel." And of course, that made everybody's day because it was the smallest things that the nurses would do, and Rose would lavish everyone with saying, "You are my angel." Well, she just made life better in that resident's home. And till one day, while this nurse was coming back to a shift, she had heard that Rose had passed. It was a very bittersweet time because they were going to miss Rose, but they knew that Rose was going to be in a better place. So next to the nurse's station, that next Christmas, they had a big frame up with all the different residents. And ironically, Rose's picture was right in the middle with her arms wrapped around all of the other nurses. And they knew every time they passed that frame, man, she was an angel. And they could hear her sweet voice saying to them, "You are my angel." Well, you angels, nurses, are angels. As you come to the rescue and you lighten the loads and the burdens of those patients that you work with, we honor you, we appreciate you, and we thank you. So with that, happy healing.